Hi everyone, welcome to week 10 in Crisis Counseling and Disaster Preparedness. I hope you download the PowerPoint. You'll need it to fill in blanks and answer questions. I only did it that way so it would be a little interactive for you guys, because listening to me talk for 25 minutes would probably be a little boring. You can view this video as a narrated PowerPoint. I just made it a video because I thought it would be easier for you to view it this way. You'll have to excuse the differences in the audio because I did my recordings at different times. And that's the introduction, so let's get started with Chapter 10, Partner Violence. Domestic violence cuts across many boundaries, such as social, economic, religious, ethnic, cultural, racial, and geographic. Victims aren't just married women. They can be single women, separated women, and divorced women. Abuse also happens in the LGBT community, so victims can be gay, lesbian, bisexual, and transgendered. Men are abused by women as well. Intimate partner violence is the politically correct term for all of this. Speaking of terms, there might be some confusion about the differences among battering, abuse, and assault. I've included those definitions on the next 3 slides, as well as a definition for domestic violence. So if you haven't done so already, pause the video and take a look at those. Wife beating used to be legal in the United States. In the 1874 case, the state of North Carolina versus Oliver, the court ruled, if no permanent injury has been inflicted, it is better to draw the curtains, shut out the public eye, and leave the parties to forgive and forget. It's not mentioned in the book, but I'd like to point out that the ASPCA, the American Society for the Prevention of Cruelty to Animals, was formed in 1866. So at that time in history, it was legal for a man to beat his wife and children, but not the dog. The book also states that it is estimated that 8 to 67% of women are physically assaulted in their lifetime. That range is huge. The book gives some statistics, but if you look at the citations, most are at least 10 years old, and the authors admit domestic violence is an underreported crime. Domestic violence is unreported due to several factors. Some cultural norms tolerate or condone family violence. Confidentiality can keep violence a family secret. Poor women and women who don't speak English don't or can't report it. Women who are institutionalized or hospitalized are often not included. Elderly gay and lesbian incidents of violence are often not reported. And gender roles based on power differentials that are still sanctioned keep a number of domestic violence cases out of the legal system. Those in the medical field sometimes fail to report domestic violence because they're afraid of offending patients, they haven't been sufficiently trained and lack adequate knowledge. Domestic violence is not something that can be cured, there can be a lack of insurance coverage, and they are also not required by the state to report it. Clerics may blame the victim and may have a hard time handling cases involving family violence, and others in the helping profession may be affected by biases and stereotypes about abused women. There are several theories as to why men abuse women and why women stay in these abusive relationships. The book covers more than what I'm going to in this PowerPoint just because of time restraints. The first theory I'm going to look over is attachment traumatic bonding theory. It states disruptions of attachment in early life arouse intense anger, grief, sorrow, and anxiety in the child and diminish the child's ability to form mutual and trusting relationships as an adult. When I first read this, I was immediately reminded of Erik Erikson's psychosocial stages of development. The book elaborates a bit more by saying men whose parents were unreliable, abusive, needy, or otherwise unequal to the task of child-rearing may be sensitive to the fears of abandonment and enmeshment. The second theory is coercive control. In this theory, batterers use violence and the threat of violence to break the victim's resistance and bend her to the will of the batterer. They may use techniques such as physical isolation, false confessions, and belittling the victim to significant others. A third theory is cultural reinforcement. This one states societal attitudes about the legitimate use of violence to achieve personal ends have their roots in a traditional perceived national interest. Basically, this one's talking about how in the United States people use aggression for protection, law and order, self-defense, that sort of thing, and then it gets extended to the family. The fourth theory is exchange theory. It states, as long as the cost for being violent does not outweigh the rewards, violence will be used as a method of control. You'll see this be used when the batterer doesn't think that the police will be called, or there will be criminal charges filed, so basically there won't be any consequences to their actions. The fifth theory is masochism. In this theory, the victim has an erotic enjoyment of pain through battering. and although this was thought to be the primary motivating factor in abusive relationships, it's now seen as obsolete. The last theory I'll be covering is Stockholm Syndrome. It states because the woman is shown occasional kindness and is completely isolated from other support systems, she develops a strong emotional bond with the abuser. My favorite example of Stockholm Syndrome is Beauty and the Beast, and I apologize if I just ruined anybody's childhood. For this slide, pause the video, read the question, and answer it. When you unpause the video, I will tell you what the correct answer is. The answer is E, all of the above and more. The book also cites a few other psychological factors. They include being an alcohol and drug abuser, having been abused as children or seeing their mothers be abused, and denying and minimizing problems, particularly battering, that they generate in families, to name a few. This slide will work exactly like the last one. If you answered A, B, or C, you're not technically wrong, but you would be more right if you chose E, all of the above, except D, that's a dumb answer, and more. The book also gives a few other psychological factors, such as being so ashamed that they hide their physical and emotional wounds and become socially and emotionally isolated, lacking personal, physical, educational, and financial resources that would allow them to get out of the battering situation, and having an idealized view of what a relationship should be and somehow feel they can fix or change the man. Again, just to name a few. There are 3 ways stressors can be introduced into a battering relationship. They can be introduced by the batterer to control the situation. They could be a product of the relationship itself, or may come from outside the relationship. Again, the book has more than what I will cover in this PowerPoint because of time restrictions. In this first stressor, women may be in an area where their friends aren't nearby. With social isolation, women are completely dependent on their batterers because they have no significant others to turn to. If a woman is experiencing economic stress, she is underemployed or unemployed, and relying on her batterer for financial income. In a stressor related to medical problems, the illness can be chronic. A man may batter someone else to affirm his masculinity if he perceives a threat to it. For this slide, I will read the statement. Pause the video and determine if you think the statement is true or false. When you unpause the video, I will give you the answer. True or false? Battered women provoke the beating. This is false. Men may think their wives are nagging them, but there are other people that are browbeating them that the men don't hit. True or false? Alcohol is the prime reason for wife abuse. This is false. Although alcohol can play a role, there are many violent relationships where alcohol is not present. True or false? The battering can't be that bad, or she would not stay. This is false. There are many personal reasons why women cannot leave an abusive relationship. True or false? Violence and love cannot coexist. This one's true. There can be violence among family members that love each other. This can become a problem because then children grow up thinking that they're supposed to hit the people they love. In the first stage of the cycle of violence, everything's pretty calm. In the second stage, stress starts to build. Violence occurs in the third stage. At this point in the fourth stage, the relationship takes on crisis proportions. One of 3 things can happen. The batterer can either ask for forgiveness, the victim can accept the abuse, or the victim can take a new action. In this instance, the abuser can either negotiate or reject the new action. And in all of these scenarios, except for the very last one, the crisis is resolved and the cycle repeats. However, in the last scenario, the crisis continues. Like the other question slides, pause the video, read the question, and answer it. When you unpause the video, I'll give you the answer. The answer is E, all of the above and more. Some of the other realities the book includes are early affection and prior love in the relationship persist, and by staying, the woman hopes to salvage them. If financially well off, the woman is unable to forgo a reduction in her financial freedom. In the cyclic nature of abuse, her mate might not be terrible 24 hours a day, 7 days a week. The victim may tend to forget about batterings and remember only the good times. Early role models of an abusive parent may lead her to believe that relationships exist in no other way. Women may hold religious values that strongly militate against separation, divorce, or anything less than filial subjugation to the man's wishes. The woman may be undereducated, have small children to raise, and have no job skills. She may be kept so socially, physically, geographically, and financially isolated that she has no resources of any kind to help her get out. She may be so badly injured that she is unable to physically leave. She may believe the man's promise to reform. She may be concerned for children who are still at home. Love or sorrow at the maid's professed inability to exist without her may impel her to stay. Because of previous negative experiences with the authorities, she may believe she has no options. And due to language barriers or immigration status, she may be unable to communicate her abuse, or she may be afraid to seek help. There actually appears to be little empirical evidence that there are any consistent predisposing factors that predict who will and who will not become a victim of domestic violence. Battered women viewed their father's perception of a woman's role much more traditionally than did non-battered women. Battered women present many of the symptoms of post-traumatic stress disorder. A family history should include hitting, threats, controlling, destruction of property or pets, forced sex, alcohol, and drug use, and the partner's hypervigilance and paranoia about the client's actions. One major rule of assessment states, when a woman calls or comes in to report a battering, believe her and start intervention immediately. Only 14% of battered women surveyed would seek help after a first incident, 22% would seek help after a second incident, and 49% would seek help only after a series of incidents had taken place. Compared to women who are not abused, battered women are 5 times more likely to attempt suicide, 15 times more likely to abuse alcohol, 9 times more likely to abuse drugs, 6 times more likely to report child abuse, and 3 times more likely to be diagnosed as psychotic or depressed. Crisis workers typically encounter battering victims in the following 4 settings: in hospital emergency rooms and other medical care settings, on telephone crisis lines, in police follow-up operations on domestic violence calls at crisis centers, and at shelters. When asking about abuse, medical workers should state that the questions are just a routine part of any medical examination. By asking about arguing, the worker normalizes the situation and opens the door for the client to talk about the reasons that brought her to the medical facility. By asking about fears, the worker validates the client's affective and cognitive bases regarding the situation. By asking questions like these, the worker can move from general relationship issues to more behavioral specific issues. This is known as funneling. The information gathered can include more specific information about the abuse, such as the number and severity of incidents, types of weapon used, and who did the battering. Once a battered woman has been identified, there is a protocol medical staff should follow. The first thing they should do is assign a primary nurse. The second is to notify appropriate support services within the hospital. The third is to give a complete physical exam along with neurological exam and x-rays. The fourth step is to document statements about who caused the injuries. The fifth step is to make a body map of old and new injuries. The sixth step is, depending on the jurisdiction, make a call to the police, identify the assailant, and have him arrested if possible. Step number 7 states take photographs of the victim's injuries. Step number 8 states inform the patient of her right to access her medical files and how to do it. And the final step says, discuss with the woman a post-hospital plan that will include shelter or other referral, safety plans if she is not leaving the abusive situation, and community support services. Some women hope that by calling a hotline the police will not have to be involved, that calling the hotline alone will be enough to make the abuser stop. Some women will want the crisis volunteer to talk the batterer down. However, the focus is on the caller and the caller's safety. When a crisis worker calls to follow up, they may find the woman in a honeymoon phase, and she may not seem to have any problems. However, she may call the next week with similar assault issues. One of the components of intervention is listening. The victim must know that the crisis worker understands and accepts her present situation in a non-judgmental, non-value-laden way. Another is supporting. The caller is given both explicit and implicit permission to ventilate, empathize, not sympathize with the victim. The third is facilitating. Strongly reinforce the victim's attempts at rational decision-making, self-control, and statements of personal power. Steps in facilitating include: be real, set limits, give the victim space and time to freak out, allow the victim to go through the pain but stay with her, maintain eye and ear contact, be respectful and non-judgmental, restate and reflect the victim's thoughts and feelings, set priorities together, look at options, stay away from whys, give the victim time to experience catharsis, but do not let her get stuck in self-pity, get back to the victim, and peer supervision and feedback are essential for domestic abuse workers. A fourth component of intervention includes ensuring safety. Determine how critical the situation is. Behavioral action-oriented techniques can be used on a short-term basis, and a plan gives the client a sense of control. Crisis workers should also help women make decisions to take action. These steps include helping women think and act on their situation by providing legitimate reinforcement for their efforts, helping women figure out what they want by providing a sounding board for examining ideas and alternatives, helping women identify feelings that prevent them from making decisions, being honest. The worker cannot tell a person what to do, but can clearly state from her own life how the situation would affect her. Helping women to do things for themselves, but do not let them become dependent on the worker. Know and offer resources from which battered women can get specific kinds of assistance. Help women gain a sense of self-confidence and ability to take care of themselves. Be challenging. Support women, but do not be afraid to push them toward a decision-making point. Be open to choices. Each woman has control over her life. The crisis worker must not attempt to assume control for clients. Hear and understand what women have to say, particularly if it does not run parallel to the worker's own beliefs, attitudes, and outlooks. Build on the commonalities that women, particularly battered women, share, but recognize the worth of the individual differences of each person. And finally, assess lethality. Another component of intervention is advocacy. Provide court advocates who understand the laws as well as someone who understands the welfare system. The center deals with telephone and on-site short-term crisis intervention and counseling. Women can stay at a shelter. Shelters also provide individual counseling, peer support, and are associated with social services such as police, free or sliding scale legal services, hospitals, medical staff and medical health facilities, mobile crisis teams, and emergency housing facilities with follow-up services. There are two types of clients at women's shelters: women who are unsure about leaving their abusive relationships, and women who have decided to leave their abusive relationships. The longer that women stay at the shelter, the greater the possibility is that they will not return to their batterers. Workers should not try to force women to stay at the shelter, but try to get them to take some psychological time out to review their situation in a more objective way. One of the issues women face in women's shelter is grief. Some women experience sorrow, depression, guilt, self-blame, and decision-making difficulty while trying to come to terms with the loss of a significant relationship. Another issue is depression. This often takes the form of sleeping more than usual. A third issue is terror. Women can have extreme and unexplainable attacks of terror. Some can fear their batterers, situation, separation from a definable past, and undefinable future. It is not uncommon for a woman to be so busy getting her act together that her emotional reactions are delayed. In the worst of scenarios, the victim may become lonely, forget about the terrible abuse she suffered in the past, invite her ex-mate over for dinner, and get beaten up again. From urging from a child or the ex-partner, she may feel pressured into reuniting. Children often receive physical abuse along with their mothers. Children who have witnessed domestic violence indicate a variety of behavioral and emotional problems that range from academic difficulties to approval of violence as a problem-solving method. In adulthood, those same children are likely to experience poor interpersonal relationships, use and accept violence as a way to solve problems, have chronic depression and low self-esteem, and engage in criminal behavior. Treatment goals include creating an alliance with the parent to help the child heal, providing psychoeducation to both parent and child about the trauma and therapy, restoring the parent's self-esteem and confidence to parent, establishing a safe therapeutic environment for the child to express thoughts and feelings, relieving the child's symptoms, including difficulty with transitions, sleeping, nightmares, and other trauma symptoms, reestablishing the child's previous level of cognitive functioning and strong attachment with the caregiver, reassurance that what has happened is not the child's fault and the child is not guilty of anything, helping the child to express thoughts and feelings and regain cognitive and emotional regulation, and finally, providing stress reduction strategies to aid in stopping emotional dysregulation. Outcomes for children involve the following: increasing knowledge of the emotional and physical effects of family violence, understanding that violence in the family is not okay and it is not their fault, a reduction in stress-related or PTSD symptoms, increased ability to self-regulate emotions, decreased negative self-talk, improved ability to identify feelings and the ability to communicate those to peers and adults, increased sense of social support, stronger connection with the non-abusive parent, and resilience to cope with future crises. It is estimated that violence occurs in approximately 25% of courtship relationships, which includes college, high school, and non-school dating populations. Adolescents who come out of violent families carry their expectations into their dating behavior. High-risk males report being aggressive towards girlfriends, particularly if they had been harshly disciplined by their fathers. For both males and females, but particularly for girls, the extent of their aggression towards their parents predicted their aggression towards their partners. Dating violence affected girls as young as 12. Among those experiencing dating violence, 37.5% reported that the minimum assault behavior was being punched, and approximately 9% reported having been assaulted with a gun or a knife. 25% of victims and 30% of offenders interviewed interpreted violence in courtship as a sign of love. Jail will not change the batterer's attitudes and behavior in any way, and he will continue to be a threat. The model used is an intervention model, as opposed to a treatment model. Goals for batterers include ensuring the safety of the victimized partner, altering the batterer's attitude toward violence, increasing the batterer's sense of personal responsibility and teaching him about equity issues, and helping the batterer learn nonviolent alternatives to past behaviors. One method used is managing stress. Participants look for physical anger cues and are asked to write down the signs as warning signals and learn to use those cues to time themselves out of an escalating dialogue that has the potential to become violent. Shoulds, oughts, and masturbatory thinking are another method. Participants are introduced to cognitive distortions. By the way, masturbatory thinking is when you take a want and turn it into a must. An example would be, I must have cake. Do you need the cake? Probably not, you just really want it. Feelings is the third method. Participants are asked to list several positive and negative feelings they have, and outcomes from denying feelings are discussed. I threw in this slide to demonstrate that there is help for victims of domestic violence at different levels, at the local, the state, and the national. I also included the links in case you wanted to visit the websites and see what they were about. Now, all of these things are located in the course shell under content, but I wanted to give an alternate way to find them. The first two were actual links. You can click them and it'll take you there. The other two, if the link in the course shell isn't working, you can go to EBSCOhost and just do a search for the title. The first link is for the history of the battered women's movement. I didn't think that the book gave a very good description, so I figured if I included a timeline that might give more information. The second link is the power and control wheel. It demonstrates the different kinds of abuse there are. In the first article, Male Victims of Intimate Partner Violence in the United States, an examination of the review of literature through the critical theoretical perspective, is a review of literature up on EBSCO that talks about male victims of intimate partner violence, and I included that in there because the book mainly focused on female victims. And the other article, Same-Sex Domestic Violence, Why Victims Are More at Risk, is in there for a similar reason. The book talks about heterosexual females, and it doesn't really talk very much about domestic violence in the LGBT community, so I wanted to include that article as extra information. I hope you enjoyed this chapter presentation. Have a good week, and don't forget about the discussion board.